Hello, it's Ryan Wicks again, and I'm here to finish the third part in the three-parts video series that I'm doing on COVID-19 uh, on COVID-19 and the subsets, the sub-videos that I've been doing. So the first video was talking about epidemiological models, and specifically in general, as well as in the specific case of COVID-19. The second video was in the series was talking about how the science that we understand about in terms of from epidemiology and our understanding of the nature of COVID-19, how that can inform policy decisions, and how those policy and behavioral shifts that we can adopt can actually impact the course of a pandemic and our understanding about what those expected outcomes are and what we know about how that has an impact, and to what degree those different social behaviors and societal shifts can mean in terms of protecting other individuals and protecting ourselves. But then I also want to do this third video that talked about simple steps and tools to adapt, which is if an individual is trying to take precautions to protect themselves or others, what can they do and where can they find resources and guidance on how to do that. And I want to do this because even though there's been public service announcements and government's been trying to put resources out there and different employers are trying to keep their employees informed, there's still, when I talk to individuals, there's still resources that I know about that I think would be very useful. So when I talk to other family members or friends that they're not aware of everything that's out there, and sometimes I learn things that I've learned from others that have been very useful for me. And specifically, I want to focus on testing. Where folks can get testing and what testing is available both publicly and privately. Traveling, getting a sense of what outbreaks exist in what regions and where you can get case numbers and get a sense of risk, as well as what travel precautions and guidance you can get. Quarantining procedures. I want to be able to talk about, most people get the gist of it, but I want to talk about specifics about specific things that are important aspects of quarantining protocols, what they are, and then where to get information and support if you do have to quarantine. If you do become sick, where you can get those, that resource support, and what kind of support you should expect. That might vary based on what your government is able to offer, or what social support programs some other agency might be able to provide, depending on where you live. But certainly I want to be able to provide links to those resources for individuals that either are dealing with the illness or directly or indirectly. And then socializing and general precautions. Most people know the basics, but just for the sake of completeness, I want to go over these, as well as where you can get more up-to-date guidance, because this has shifted over the last few months a little bit as we learn more about the disease. And as well as accessing information in general, where you can get more robust information for those that are curious of mind, or just having other resources to be able to pull from other information sources. So, let's move on. Testing. There's different kinds of tests that are available. There's a lot of different kinds of tests that are available. And I actually haven't listed them here in this link, but in general, there's two different kinds. There's the antigen test and the PCR tests, and there's many different variations of that, many different specific tests that are done. They have a lot of similarities, but every time that there's a company that comes out with a new test protocol, they have to register it, for use in the United States and in other countries too. And there's dozens upon dozens of them. But generally, they fall in two categories. One is PCR, which is polymerase chain reaction. Which I believe they use a restriction fragment length polymorphism with a gel electrophoresis to categorize it, but don't quote me on that. I haven't looked at the specifics on some of the tests. But then there's also the antigen tests that look for like the protein signature. So one's like a genetic test, and one's a protein. But in terms of, and that's important distinction because some of them are more reliable than others. Some have more, I think PCRs tend to be the slightly more reliable. They have fewer false negatives. And so I think they're, a little bit safer. Not, the antigen test isn't terrible. It's better than nothing. They also have different ranges of sensitivity and criteria under which they actually will detect the disease. And then also false positives. I'm not even quite sure what the statistics are on each of those, but anyways, it's important to pay attention to when you are traveling or need to get a test, because it might not, like for instance, in Massachusetts, the antigen test does not satisfy travel requirements because it's not considered reliable enough, I suppose. For whatever reason, Massachusetts government does not accept it as a legitimate test in terms of quarantining and travel procedures. So just pay attention to your local regulations about which kind of test you can get, and just try, and then also get information on the specific kind of test you're getting. My understanding is the PCR is slightly better if you can get it in terms of knowing if you're currently infectious. And certainly talk to your healthcare provider if something does come back positive. And we'll talk about that in some of the other slides. All right, so before and after traveling, as per a travel advisory, if there's one in your area, even if there's not a travel advisory, it's usually a good idea, especially if you're going to a region that has a higher infection rate, just to protect, or if you're traveling from a region that has a higher infection rate, you should protect the people where you're going to travel to, or protecting the people where you're from when you come back from the area of higher infection. Obviously, if you develop COVID-19 symptoms, most people know what they are at this point. I don't list them out here on these slides, but I certainly in these links you can find them. Things like flu-like symptoms, fever, dry cough, and a whole bunch of other things, depending on the severity of the illness, which not everyone gets. But if you do get those symptoms, you should probably, what I would suggest is that it's a good idea to assume that you have COVID-19, even if it turns out to be something else, because this is such a prolific disease currently. And if you have your flu shot, then it's less likely it's the flu. So if you don't have your flu shot, well, then that's just a harder problem. All the more reason to get a flu shot so that you don't have that compounding problem. Recent contact in the past 14 days of anyone that's confirmed or suspected of COVID-19. So it's confirmed or suspected. So if they're suspected to have COVID-19, but they haven't had it confirmed, you should still quarantine for 14 days. If you want more information, you can get it here. The requirement in Massachusetts is 10 days, but they still advise 14 days. Asymptomatic testing. If you aren't familiar with the testing programs that are available, there's this nice map that's available online. It's hosted by ArcGIS, or by Esri. But is populated with state-run programs, many of which are free for Massachusetts residents, for instance. And then there's more details about locations and hours of operation here. And this is from Massachusetts, so depending on wherever you are in the world, hopefully you have something similar to this. Usually there's government agencies that are, hopefully there should be government agencies that are making resources for you to be able to find testing centers and locations. This is just, I work at UMass Amherst, and this is a checklist in terms of talking about symptoms that many of the people that work at the university have to fill out daily. Certainly we're advised to monitor for. I just thought it was a good checklist, so I thought I'd share it. Do you have a fever without taking any fever-reducing medications? Have you lost smell or taste, muscle aches, sore throat, cough, shortness of breath, chills, headache, gastrointestinal symptoms such as nausea, vomiting, diarrhea, or loss of appetite, close contact with someone suspected or confirmed COVID-19 or been advised to quarantine because of COVID-19, or have you been asked by a medical professional to quarantine for whatever reason because of suspected COVID-19 contraction. This is, a pretty robust list. This doesn't cover absolutely everything, but this is like the vast majority of things that, are arguably things that you should look out for, the major players you should look out for. So this is the map of the testing sites in Massachusetts. So there may be something local in your area as well, if you're not in Massachusetts, where you can find something like this. And if you click on one of these, it gives you the different, what kind of health insurance they support, if they're, publicly funded, if it's free testing, Massachusetts residents versus not residents, drive-through versus an indoor clinic, so on and so forth. If you're traveling to a high-risk area, I talked about getting testing done for that. You can reference this travel order for Massachusetts and Maine. I've also checked Maine has, travel orders. I think most states do. In the case of Massachusetts, they're pretty serious about this. It's $500 per day of violation where you're not actually filling out the travel form. You have to like fill out this form and then actually quarantine or get a test, and it has to be a PCR test. And every day that you've gone to a high risk area and returned and then haven't been quarantined, or if you don't have a test, it's $500 per day. I'm not quite sure how they got to that price point, but certainly it's meant to deter people from taking risky behaviors. And there could be an argument that I imagine was probably made about something of the effect of it has some cost to society if it's contributing to the spread of the disease in terms of treating individuals that are sick. Yeah, so you can, the travel orders here in this first link, and then the second link is guidance for how to proceed. And I've done this several times. I have coworkers that have done this several times. It's actually pretty easy. So hopefully wherever you are has some kind of guidance for travel. Hope, I'd argue if they're serious, then there'd be actually some kind of enforcement, or it's a fine or something. And then arguably they should make it easy to do, right? So this takes like 5 minutes in Massachusetts. It's a piece of cake. You can go ahead and check out those guidelines. And I would just say that this is a good example of how to manage a travel guidance program and regulations. Just make it really easy for individuals to follow and make sure the information is pretty robust. This also has information about the specific tests. So if you were looking for what kind of tests you can get, I mean, they might only be applicable to Massachusetts, but then you can see the full list of all the tests that exists, right? So Massachusetts will say whether or not they accept them or not, but you can see all the tests. I believe at this link, I might be thinking of another one, but in any case. CDC also has guidance on travel information, travels, but because the US hasn't had a coherent universal program in place on a national level, it's very state by state. The CDC just gives guidance. It doesn't actually give regulations because those regulations vary from state to state. Okay. So this is specifically from mass.gov. This used to be different. The Northeast used to have different, these used to be lower risk states. Now it's only Hawaii. Virtually every area in the United States is considered high risk. Massachusetts is listing itself as low risk, even though other states and surrounding area list it at high risk, but it'd be odd to have you quarantine inside the own state that you're traveling to. Like that, I think that's what they mean by this map. It's not to say the Massachusetts cases are great. They're just saying, oh, we're not going to require you to get tested because you stepped out outside your door. You can also have a CDC tracker. You can also have a case tracker about where there were outbreaks and high caseloads from the CDC. This is another tracker that you could use. I talked about Johns Hopkins dashboard, and so the link is down here below. This is for cases by country if you're traveling internationally for whatever reason. Again, that's probably quite risky, and actually the US is probably the riskiest place to go, one of the riskiest places to go, but you can certainly check other countries and their trends as well. Whether, if you're traveling somewhere else, then you should probably take precautions and be advised that those countries might have restrictions for you traveling. Also, with the outbreak of the new strains from the UK, there's actually lots of different strains. One of the links I provide talks about like the plethora of strains that have been identified of COVID-19, but there are a few specific ones that are a concern that people talked about in England. So there might be additional restrictions for depending on where that strain is. Again, I showed this in the beginning in my first video talking, there's this other map from Johns Hopkins, which is county by county in the States, in the United States. There is more granular information than this, but Johns Hopkins has it on the county level. You can get it town by town in Massachusetts, and I believe other areas as well. And the CDC has made their the data that they use publicly available for tracking, and the tracking data that they have publicly available their case data, right? Their COVID-19 confirmed case data is publicly available for other people to reference and use. But it's nice to have an interactive map. And then one thing that when you do find a county, you can actually get specific information. You should see a report like this that's updated daily in terms of current cases and cases on the new day and demographic information and statistics on the spread of the disease over the course of this past year or the entire pandemic. Quarantining. All right, so I'm going to break this down into a few different steps. When to quarantine. Recent contact in the past 14 days with anyone who's confirmed or suspected, right? So it's not like oh, well, they didn't confirm it because I didn't get a test, so I don't have to quarantine. No, if they were suspected of having COVID-19 and have been advised that they might, and they should quarantine, and you've had contact with them the last 14 days, there's strong, the guidance is that you should also quarantine until, you produce a test, or and have waited a few days after that. And it's important to have that, not just the test alone isn't good enough, because you might not become symptomatic, or the test might not detect the virus until several days have passed after exposure. But the specific information and guidelines can be found at these links from mass.gov, that I'm more familiar with, and the CDC as well. Or the other time you would want to quarantine is if you travel to a high-risk area, which is virtually everywhere in the US right now, as per the travel order, which I just talked about in one of the prior slides. So you can get guidance for travelers, as well as here's the actual travel order. Here's some additional information. This URL right here has much more detailed information about quarantining information. There's also in Massachusetts and other locations, although this will vary, is this contact tracing, where the state actually has programs where folks that have been identified to be COVID-19 positive will be contacted by the state and say, hey, who did you have contact with? Can you help us get in contact with them to help advise them that they should get tested as well, to help stem the tide of cases spreading. And if done effectively, can actually suppress it, critically dampen the disease to the point where it doesn't spread. It's very hard to do. It's very labor intensive, but it actually gets you. It's a great way of this is another source for all those estimates, those parameters I showed in the first video. This is another way you can actually get a sense of how effectively the disease can spread, because you actually are looking at specific cases and you have a holistic view of every person that person had contact with and where they went, right? So it gives you much more high resolution information on how the disease is spreading. But this is also important for protecting people, right? In that immediate case of this person was sick, this person may have given it to these people, they should be advised on getting tested, quarantine, and any other protocols they may want to do in response, or behaviors they might want to take in response to potentially being infected. So if you need to quarantine, it's not, during the pandemic, this has not been, I know this hasn't been cleared. It hasn't been clear to everyone exactly what this means. So I just wanted to go through some of these points to the specific action items, what it means to quarantine. So in general, it means just stay at home and use a separate bedroom and bathroom if possible, if you have other people in the household are not infected. It's possible where you don't transmit the disease. It's difficult. It's, the odds are quite high that you can, but it is possible to get through an entire infection through the infectious period without infecting other people in the household. It depends on whether you have circulated air. You don't want that. You want to think about these things, what the air is circulating through the house in terms of central air heating systems or air conditioning, or if you have fans on, things like that. But certainly getting people in a separate bedroom and bathroom, and then giving food to them, putting it down outside their door, leaving for them, and then treating plates and utensils that you collect from them as being biohazardous, right? You just certainly wash them. Maybe not biohazardous, but certainly wash them as those plates or utensils being contagious, because they certainly will have viral particles on them. That is if the person's symptomatic, right? If they're asymptomatic, there's a chance they wouldn't, but don't risk it. Just be safe, is what many people would argue. Do your best to stay 6 feet away from other people in the house, right? As I talked about, do not leave your house to go to school, work, or run errands. Nothing. Stay in the house. You don't want to have any exposure with anyone else. By my model estimates, it was 3% chance every single interaction. If you're just going down the street, it's potentially multiple interactions, and very quickly you can rack up a likelihood where you're likely to transmit to someone, which is how the disease would spread and escalate if that's not being followed. to a significant degree. Don't have any visitors during this time. Like, I know you're sick and it's going to be hard if someone's sick to actually stay isolated. That's when you want social support. Try to find other ways to get that social support. There's stopping by the house, maybe staying outside, waving from the window if you don't have like a phone or internet access. Certainly leaving packages and parcels that a person could pick up, get well cards, things like that. But if you visit the house and someone's sick, the likelihood of transmission is very high. So especially if you live with someone, also you shouldn't be going out because there's a really good chance that you also are contagious, even if you haven't started to show symptoms yet. So everyone in that household should be quarantined. They really should. Regulations I don't think strictly require someone in the same household to quarantine, but certainly, as we discussed in earlier slides, that is highly advised that they should. And there's plenty of ways to get support and like get things like groceries, call friends, call family. There's even just like services that'll just drop off groceries for you. So certainly not a necessity to go out in many, many cases, at least in the United States. Some areas might not actually have any option to socially distance as effectively as we can do in the US with all our cars and transportation systems and food distribution systems. We're really lucky in the United States to be able to have those resources to do that in many cases. And that's what, you have family and friends in many cases. And there's certainly services that, you can pay for delivering groceries if you don't have any family or friends in the immediate area that can directly help you. Which can be disheartening, but it's, the option is, if you want to try to protect other people in the community, that's the best way to do it in many cases. There is an exception for needing to go for like medical services, in which case you can call your doctor up or something like that, and they will advise you on how to get medical treatment. You shouldn't like forego serious emergencies and urgent care needs, mental health needs, whatever it is, or other diseases you might be dealing with. Certainly those should be addressed, and there are exceptions in the regulations that you won't get zinged for that. But definitely talk with a doctor and healthcare provider about how best to go about that. Certainly wash your hands frequently with soap and water for 20 seconds. That's, everyone's heard that, right? And that's mainly because you don't want, if your fingers are having contact with things, the virus will stay on there for several days, and you don't want that then getting in your eyes. I have a hard time with that, so I make sure my hands are pretty darn clean. Do not share or eat food or drink with anybody. Yeah, if you're contagious, that should seem pretty obvious, right? That's probably even a far more likely way to spread the disease, almost guaranteed, even more so than breathing air with someone. All right, so these are the links below for a talk, that have more specifics on the information that I've talked about from mass.gov, and the CDC. Monitor your health every day. This is more for your own health benefit, right? Like make sure you're checking up on yourself, making sure, you're taking temperature if you can. Just do a mental check-in. You don't want your health to slide because this is a dangerous disease and it can get pretty serious pretty quickly. If you start to have serious problems, you should contact your healthcare provider or emergency health services. If you get sick with fever, cough, shortness of breath, or other signs of respiratory illness, call your healthcare provider and schedule a COVID-19 test. Be sure to tell them you have been exposed to COVID-19. This is if you had suspected that you might have contracted it, right? Obviously, if you get one of these diseases, or one of these symptoms, might be a good idea to actually get a test done. Again, routine medical care is allowed. Just talk to the doctor beforehand because this has to be done very, very carefully so you don't make everyone sick that's also going to the doctor sick with COVID-19 when they already are dealing with other health issues. Public transportations, taxis, ride shares, definitely don't do that for getting to an appointment. So again, talk with a healthcare provider about how to do that. And again, these links have a lot of information about resources for doing this. So these are the specific links that I would recommend checking out for Massachusetts and the United States in general. Internationally, there's probably something that your government's able to provide, or hopefully your community can provide, but I'm not well equipped to be able to address it. I did talk about here, if you want to learn more about the community tracing that's existent in Massachusetts, I would check out this link. as well as about like what protocols and what, how they protect privacy and things like that, and like what the specific steps are that they would do, so you can know what to expect, and then how to communicate to people you might have interacted with, but you don't know how to reach them. The government can help provide that support. And also you might get contacted, so you can understand where, why, if you're getting contacted, what you can expect from the agencies that are running those programs. Also, isolation and recovery sites, at least in Massachusetts, are available. So if you don't have a place to isolate and you like live with other people, but you're concerned about their health, you can isolate in these state provided houses where they provide direct support to you. And you can isolate with other individuals, or you can isolate by yourself without exposing other individuals. So this is just the graphic that's from mass.gov talking about quarantining, right? So if you confirm, if you're confirmed positive, you'll get in touch. You'll hear from a care resource coordinator, and they'll get you the help that you need. If you have cell phone support, you may get a call. You'll probably get a call. You should get a call according to this program, right? And they'll ask you about contacts. They'll give you an ID where it's anonymous information, so that when they then reach out to these other individuals that say, hey, you may have gotten in contact with someone with COVID-19, they won't necessarily tell who it is, and that can be maintained your privacy. And this is just the specific example from Massachusetts. There's other state programs that are out there depending on your region in the world. There are some programs where they'll actually have anonymous case data, by location up on a website, and people can check, like, I went to the store, were there any cases there that day? No, great. Next week, oh, there were 2 that day that I was there. Maybe I should go get tested, right? So those are other options about, informing the public on how to protect themselves that protects privacy as well. But again, check out this link if you want more information about what's going on in Massachusetts, and example of what a contact tracing operation would look like. Right. And then when to end quarantine, right? You might know, I'm sick, or I might have contracted COVID-19, but when is it safe? When will I not be a threat to my family or loved ones or friends, or the general public, or when, if I want to go visit someone, when are they clear? Guidance and expert opinion varies. Talk to your healthcare provider, right? They're probably going to have the most up-to-date information, because this actually has changed over the last few months. Usually it'll be 10 days that have passed since your symptoms started, or at least 10 days have passed since a positive COVID-19 test. And you haven't had a fever or any other symptoms for at least 24 hours. So it needs to be at least 10 days. And during that 10-day period, you haven't had anything for 24 hours, because like I talked about, like that recovery period can vary. So it needs to be both. It needs to be at least 10 days and 24 hours without symptoms, because symptoms can actually go away for a little bit, and then there can be a resurgence of symptoms within that 10-day period. Yeah, you can end a quarantine when you're feeling better, but these criteria need to be met. And talk with your doctor about if it's safe to be around people. So after 10 days, you're feeling better, it's been 24 hours, talk with your doctor and be like, hey, here's what I'm experiencing. What do you advise? Mass.gov. Oh yeah, same link. Right, just more information. I'm just sharing on another slide. Okay. Specifically, this is from that that URL. This is the timeline depending on whether or not you have a negative COVID-19 test. So if you have possible exposure and you're quarantining, so you have your day of exposure on day 0, and then get tested on day 5. And then if that test is negative after the 7th day, you're allowed to go back, and there's no regulation that will penalize you for going to the public or going to the store or things like that. But you should definitely monitor for the next 14 days. If possible, it's probably a good idea if you're, if you think there's a chance, there's still some risk in here. This, the government says, okay, well, we're not going to penalize you, but you still might be a risk to other people. So you should probably still, if at all possible, minimize or don't have contact with individuals for 14 days. But if you do, make sure you're being super careful about your symptoms. And if you suspect your symptoms, if you think it might just be allergies, or something that you get the sniffles, and even it's minor, maybe get another test or just quarantine for another week. With no test, it is a 14-day quarantine. I'm sorry, 10 days is the requirement, but again, they recommend that 14-day period, so definitely monitor and be super careful. Limit exposure, take extra precautions, if any, right? You still might want to just quarantine for the full 14 days. All right, so socializing and general precautions in general: wear a mask, limit contact with all others, stay outside, and stay at least 6 feet apart. So don't have indoor gatherings wherever possible. But always, wear a mask, and, most people have heard this, right? So, but specifically, more, updated guidance can be found at this URL. This is for Massachusetts, but in general, I've found that it's pretty good advice for anywhere, right? But you can check your own local government's advisories, and yeah. So I do want to briefly do like a throwback to when talking about like the science of why we have, why there are these precautions and what the intended impact is. So if you limit the interactions with others, it reduces W, which was the total interactions that your pod would interact with. The idea being that in this graphic, right, if each one of these green circles is an individual, and then yellow lines are lines of interaction or connectivity, these small clusters are like your pod cluster, right? And so like there's heavy interaction here. So I've drawn them as solid lines, and every single person in that pod or virtual family is interacting with everyone else in that virtual family, whether you live together or not, or you just socialize regularly in a closed space, right? And so I've said, like, maybe your pod's 3 people, maybe it's 4 people, maybe it's 5 people. I don't know, but it shouldn't be too much bigger than that based on, this table that I showed before. The idea being that there are still these weak connections that you're having in public, even when you're wearing masks, and even if you're only out briefly, that you can still have transmission. And even though not everyone in that pod has interactions with everyone else, limiting these interactions keeps these pods isolated. So it's very likely that one of these individuals does get infected, which continues to happen. We're continuing to have spread of COVID-19 in virtually every community around the world. It is hopping from one cluster to the next cluster. These hops are happening between pod clusters. But the idea behind the protocols that are in place and the social behaviors and guidance that are in place is to help minimize that and reduce that below, a certain threshold, to keep R naught less than 1. The replication number less than 1. But it is hopping around. So the idea is that if one person gets sick, one of these individuals gets sick, it's likely that everyone in that pod is going to get sick. But because of the social distancing measures and the mask wearing, it means that before, in interim time, before one of these individuals and all these individuals recognize they're probably contagious, it is unlikely they'll transmit to the rest of the, people outside the pod. So limit interactions, reduces limit interactions with the public, and this reduces your replication number. And like I tried to show here in this graphic, if your pod's larger, there's necessarily more, there's, on average, that means there's more interactions with the general public for that pod. So it's even riskier for not just for yourselves, but for everyone else in the public, because every single person is sharing the risk that they're inheriting from the public. So this individual is inheriting risk from the public. This person's inheriting risk from the public. And so they're adding up and then sharing it with each other and then projecting that risk back out. Yeah, limit your interactions outside your pod. Use precautions. Limit contacts to small exclusive groups. No group with high-risk individuals, right? So like if someone, like, you wanted to have a pod and you're like, all right, we're going to try to keep people safe, it'd be a good idea not to have someone that, isn't taking any precautions, like refuses to wear a mask and, socializes with lots of other people. So certainly small exclusive groups means that, like, oh, I see 4 people, but those 4 other people that you see should also only be seeing those 4, you and those 3 other people. There should be no crossover, right? Because then you don't have this kind of network. So if you have these constraints about your node connectivity, right? These are nodes and these are edges, right? You can say something about the connectivity of this graph, right? So if you want to know more about nodes and edges, check out graph theory. Anyways, just a a type of mathematical model, and there's people that study this for their careers. So not just in terms of pandemics, but in terms of information theory, in information spread and cultural spread and all kinds of interesting applications. And one thing that I've advised from talking with friends about, trying to figure out, like, if we're going to do a pod, how are we going to do this? Certainly, if you want to, I talked about having exclusive groups, but if you want to leave or re-enter an exclusive group, have like a 7 to 10 day period between moving from one group to the next. If you leave one group, wait 7 or 10 days before joining another group, right? Because you need to treat that as, or get a PCR test on day 5 and then wait 2 more days. But essentially treat it like a quarantine. Treat it like you are suspected of having COVID-19 before moving to a different group. So that way you don't transmit between 2 groups, because it's just a way of guaranteeing that you're not hopping between groups regularly. Because a lot of tries, what's the criteria to say like you're in a pod versus not a pod? Well, I'm in this pod one day, I'm on another pod the other day. I just switch between the 2 days. It's virtually the same as not having a pod at all. So this is why, I'd say have this like week-long, ideally 2-week-long period between, at least a week-long, ideally with a test, or 2 weeks where you're in between shifting groups if you so chose. Switching groups was treated as if it requires quarantine. So that's just something that I talked about with friends, and we tried to like frame how we could do that safely. We've opted to I'd say this is the limit to risk. You can certainly be safer than this and decide that keep your pod even smaller. And maybe you're someone that doesn't is fine just socializing online. But if you're going to socialize, Massachusetts even says that you can't have groups more than 25 people in even private residences. In public spaces it's 10, right? So there are certainly restrictions, but I would say even those are probably too risky. And I think the state knows that those people are going to take more precautions than that. All right. And so again, if you're trying to figure out how big your pod should be and how much risk you're inheriting and how much risk you're projecting, if you didn't see one of my earlier 2 videos, I did put this table together so you can do your own risk calculations for your particular region, for a particular caseload in the last 14 days. Your region and caseload will inform your personal risk, which is all these columns here, either with the 1 through 120 days and the number of interactions that your pod is interacting with in the public total, right? So this is saying like right here is 10. This means that everyone in your pod, if you added up their daily interactions, comes out to 10. Here's the risk they're inheriting after a single day and so many days for the particular caseload in that particular region. However, I will remind folks that the last column here is, or just if you hadn't seen the first videos, this last column is saying here's the a rough qualitative estimate for. It's a quantitative estimate, but it's kind of vague because it's hard to nail down specifically. But it at least gives you a general sense about the trends in risk. This is risk to the self and to everyone in your family, your virtual family unit, or your pod. And this is the risk that your pod or virtual family unit is projecting on the public, given that behavior patterns, given the number of interactions that you're cumulatively having. Right. So the more people you have and the more interactions that each person has, those add up and cause you to shift down these rows, shift down, to higher numbers in this column, which correspond to these rows that correspond to the risk for that particular row. Right, so certainly I would say 6, right? So if you had 6 people each only interacting with one person in the public on average per day, that includes going to stores. So like, that's over the course of a week. What's your average interaction? So I would say everyone, even if you're interacting with no one but just go to the store, that's like 1 interaction per day on average, something around there. Maybe it's more, depends on your store, or if you're doing grocery pickup or something, right? But certainly try to gauge what your cumulative interactions are over the course of the week. If you're going to work with people, you work with a small group of 3 people, that one person has already contributed 3 to your daily interactions, and then add another one for groceries. That person's already at 4, right? So if it's one other person, there's 2 of you doing that, you're at 8, right? And you're already starting to push the limit of what's probably too risky in terms of, a standard behavior pattern that will, if it's riskier than that, you'll have runaway growth with the disease. So anyways, check out the spreadsheet. And you can, I talk about it in my first video about how to use that spreadsheet for assessing risk to yourself and to others. And that's just to help, size how you want to do your pod, right? So, but I want to talk about it again qualitatively here. So accessing information, there's going to be more information that's coming out, and there's certainly a lot more information out there than I can cover in these videos and this presentation. These last few slides are just saying here's where you can get more information, right? These general like home URLs that you can like save in your favorites or in a text file somewhere, that I've also put in the description for the video. CDC information, the general landing page is here. They have weekly updates that are available here. You can get a high-level view about the trends, what's going on in this country. Massachusetts has a similar thing, but only for the state. Updates and information, and they have weekly response reporting. And these reports are quite detailed. You can look at demographics, how those are shifting over time and growing region by region. So quite robust. Finally, these last two are not state agencies. They're independent projects. So the first one is Johns Hopkins University. This link here, I've referenced them multiple times. There's another one that is in my references, but I think they've done an excellent job. It's just an individual, Yuyang Gu. I think I misspelled. I missed a G here on his name. Sorry, Yuyang. Yuyang Gu's project. And this is pretty robust. It's pretty amazing, right? So he's done this a video on this, presenting about how he put together this website, and he's compiled public data, and he's done his own modeling work. It's quite robust, far more robust than anything I've done here. And it's really quite interesting. That you can check it out. And he has been cited. My understanding is that he has been cited by a bunch of different agencies. That the work he's done is pretty insightful. So if you're an independent modeler, you too can make a difference, right? It's the takeaway, and his insights are really interesting and helpful. So I would check it out. It might be a source that you want to reference regularly in terms of he models like R naught in real time, which other agencies do too, but he just has a nice website to make it available, and you can understand how what are estimates for how the disease is spreading in a particular region. And then I have my additional references. These are my last few slides. I did want to do a shout out to this one right here. In one of my earlier videos, I talked about saying, oh, there was some paper that I read that talked about, the relationship between, social interactions. And then, so I was trying to estimate the rate of transmission of the disease based on some stereotypical interaction. And so this study actually started to get at that, where they actually had anonymous data about social interactions and how that then corresponded to relative rates of spread of the disease. So I thought that was really interesting. They also talked about masks and eye protection and the effectiveness of those just by looking at case data and relating it to mask wearing procedures and things like that. I have a lot of other references, so I'm just going to pause on each of the slides so that you can look at them, just so they're in the video, but then I also provide these in the link in the description. So I'm just going to scroll over these. I might want to say something else. COVID exit strategy is another just independent organization. It's not a government agency that has information, and it's actually how I heard about Yuyang Gu's website. COVID projections, that's his website. And there's a few other presentations that I've found particularly useful. So there's a whole bunch of YouTube videos and presentations from experts that are quite useful, and I've linked to those. A few of them are from Dr. Mike Henson. A few of them are from, this one's from public health officials. So, quite insightful from subject matter experts. And that's it. There may be a few other sources that didn't make it into the video, but everything I've referenced in the slides, or even those that I might have missed in these last few slides, will be in the description. This may be helpful. This may be redundant information for some of you. This may be helpful for some of you. But in any case, be well. And I will stop the recording. Be well.